Greetings, friends. My name is Norm Beauchamp. I'm the Executive Vice President for Health Sciences at Michigan State University. I want to apologize for missing the Grand Rapids Chamber Health Summit last week. I was so excited when I learned that we as a community were going to come together to figure out what are the ways that we can address the needs of people everywhere by coming up with the solutions in partnership. It's work that we've been doing, but I think for all of us, COVID-19 provided really an even greater call to action. We as a nation felt that we were prepared for most challenges that would come to us, that we were amongst the most prepared nations in the world. And what we found was that when we were faced with a pandemic, we didn't have the trust, we didn't have the ability to communicate, and we didn't have the solutions in place that would be scalable to meet the needs of people everywhere. Now, what I was so encouraged by, however, was just the pace at which the community came together. It was health system partners, it was public health, it was higher education, it was scientists coming together to find the solutions that were necessary, whether it was coming up with new ways to provide access to care, ways to educate, ways to inform. It was inspirational, and yet it was still quite clear that we had more work that needed to be done. And so what I'm enthusiastic about is the lessons we learned, combined with the work that's been done to date, really positions us now to hit a harmonic where we can move more quickly to meet the unmet needs in our community and our state. Some of the areas that we're particularly focused on is primary care and mental health. We've worked with the state to develop increased training programs in both of those areas, and our medical school and our nursing school is recognized for our focus on training the next generation of providers. But what we think is so critical is that we're not going to be able to train enough people to meet the needs of people where they live. And it's projected that even with the scope and scale of the training programs that we have across the state of Michigan, there will still be a significant healthcare shortage, and there will be inequities that come as a result of the under-resourcing of clinicians. This is where we see technology coming into play. Technology coming into play. And what we've set up in the Innovation Park is working together to have the work that we do in clinical care, education, and research really align. So then when it comes to clinical care, if we identify a gap in what needs to be put in place, we can go up to education, find existing knowledge, and make sure that it's brought to bear in clinical care. Similarly, what we can do is if there needs to be new knowledge generated, we can also generate that knowledge and translate that to the clinical care that we deliver. And one of the big focuses we now have is that when it comes to the areas of discovery that are to meet the needs that we serve, it's going to be enabling technology that we're going to use to do that work. And what we've brought together on the Grand Rapids Innovation Park is a number of individuals that are experts in developing technology. So housed in this space, adjacent to where we do education, where we provide clinical care, where we do research, are experts in things like the Internet of Medical Things, artificial intelligence, machine learning, design thinking, bioengineering, and people with expertise in public health. And so what I want to share with you is this ecosystem that we've developed allows us to work with all of you that are interested in overcoming the challenges that exist, or in helping to develop the solutions, a partner. A partner that is connected to the community, a partner that is connected to health systems across the state, and ultimately a partner that recognizes the only way we'll solve the challenges we face are together. Something that I'm really proud of, and I'd like the community to be proud of, is as we have looked at the example of what's happened here in Grand Rapids, the possibility of bringing together clinical care, education, research, innovators, and community, it's impacted how we as a university are thinking about what's possible. And it's resulted in coming out with a strategic plan that has made sustainable health, health for all people, a primary focus. We refer to it as the Sustainable Health Core Pillar, and in that, moving forward, our plan is to work on advancing health and excellence in health education with a focus on people, communities, partnerships, and innovative thinking. A few examples of what we see as outcomes. One, we're going to identify a health disparity, and right now our focus looks like it's going to be on maternal fetal health, and say by 2030, we're going to close the gap so that where you're born or the color of your skin doesn't determine the likelihood that you'll have a healthy baby or a successful pregnancy. We're going to focus on creating 50 new pathways to careers in health, campus-wide, and recognize that careers in health can come from a communications background. It can come from supply chain and business. It can come from agriculture. It can come from architecture, veterinary medicine, or the more traditional physician or nurse. But what we're seeking to accomplish is to make Michigan State a place that if you're interested in improving health, we will help you develop a pathway to a career. So with that, again, I thank you for letting me come in a week late to share this with you. And I'm just incredibly enthusiastic about the partnering that we've done in the community and what the future will allow as we work together to go directly at the challenges people face. So thank you.